Services, and I'll be your moderator for the COVID-19 update for Tuesday, April 28th. We are joined today by Yukon Premier Sandy Silver and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Following their statements, we will go to the reporters online for questions, and following our regular process, one question per reporter with one follow-up. If we have time, we will entertain a few questions after. Thank you. Premier Silver.
Thanks, Pat. Good afternoon, and thank you everybody for joining us today. I would like to begin by acknowledging the day of mourning. We take time today to reflect on the lives lost due to workplace incidents, accidents, and those who suffer a work-related illness as well. This year more than ever, our country is grieving. The recent deaths in Nova Scotia have impacted us all. One very notable death was of Constable Heidi Stevenson, who died on the job protecting Canadians. Everyone should feel safe at work. Earlier today, I was honored to make a pledge on behalf of our government to keep workplace safe today and every day for all Yukoners. It has been several weeks since COVID-19 pandemic changed how we live our lives here in the territory. As the days and weeks go by, people are wondering when things will return to normal. I can appreciate the yearning to get out of our houses, to socialize with friends, enjoy a meal at a restaurant, and get a haircut, which I desperately need. The frustrating part is through all of this is that determining an end to the current restrictions, well, that's not very simple. It's very complicated. It can't be based on any one thing alone, and it will take time and considerable planning as well. As of today, we have 11 confirmed COVID-19 cases in the territory. Our numbers remain low, and that is an extremely good thing. What it means is that the measures that we have been taking to address this spread of the virus in Yukon, they're working. These measures have been disruptive and challenging for all of us, from home to work life, business operations, socializing, and everything in between. Everyone is impacted by this situation, and it has absolutely not been easy. I want to thank the healthcare professionals working across the territory to keep our communities safe and healthy. I also want to thank the many frontline workers who continue to show up day after day so that Yukoners can get the food, medicine, and supplies that they need to manage during this pandemic. Our territory would not be able to function without you. And staying home is simply not an option for you, so thank you. I would like to make note of the great people who work and do great work with the medical laboratory work in Yukon. This week is National Medical Laboratory Week, and I would like to celebrate the contributions of Yukon's dedicated medical laboratory professionals. These people, these professionals, they work tirelessly, not just during the pandemic. They work tirelessly to provide a life-saving service by giving timely, reliable medical test results to help diagnose and to treat Yukoners. I encourage all Yukoners to join me in thanking medical laboratory professionals for their expertise and dedication as a core member of our healthcare team. I would also like to thank all Yukoners for pulling together, supporting one another, and being patient as we work through this situation. As I said, everyone is impacted by this pandemic. The government of Yukon is here to help Yukoners through these challenging times. We are supporting Yukon families, businesses, and workers to keep our communities strong, and we will continue to do so. Thousands of public service representatives, workers, they are working tirelessly to rapidly adjust programs and services to address the ever-evolving situation that we find ourselves in. The Yukon government is one large and diverse organization, and COVID-19 has prompted a significant shift towards a highly adaptive, nimble, and responsive approach to public service. So I want to thank all of the staff for their efforts to continue providing Yukoners the supports that they need. The collective effort in the territory to minimize the spread of COVID-19 and to mitigate the social and economic impacts continues to be inspiring. Now, the reason for all of these thank yous, again here today, it is absolutely vital that these efforts are not wasted. When it comes to easing restrictions and reopening the economy, we must take a precautionary approach and act with an abundance of caution. Our priority as a government is to ensure that we use public health as a foundation for our decisions, to ensure a successful reemergence and restart of society and the economy when the time is right. If we move too quickly or without understanding the necessary planning and coordination, we risk increasing the spread of COVID-19 in our territory. That would force us to reintroduce restrictions that would further disrupt society and economic conditions in our territory. And nobody wants to see that. At this time, we are undertaking the necessary planning and working with the rest of Canada in charting the pathway forward. I have been speaking regularly with my fellow premiers across the country to ensure that we are all working together in a coordinated manner as we look at easing restrictions. Today, Canada's First Ministers released a shared statement on the guiding principles that we see as central to safely restarting society and the economy. The approach outlines the conditions needed to begin moving towards a gradual and phased approach to lifting restrictions and getting our communities moving once again. At the heart of our approach is the need to continue protecting the health of Yukoners and all Canadians. The easing of restrictions will be gradual and will be done in a way that protects high-risk members of our communities. Yesterday, Minister Frost announced that we have received additional ventilators for the Public Health Agency of Canada, significantly increasing our territory's capacity to provide acute care in response to COVID-19. But as Dr. Hanley and I discussed earlier, we don't want to have to use these ventilators. While we have not had any cases of COVID-19 requiring hospitalization, it is essential to ensure our public health system remains well prepared to address the pandemic going forward. We remain committed to a science and evidence-based approach while keeping in close alignment with the rest of Canada to the degree that it makes sense. It is important to note that each jurisdiction is in a unique position when it comes to COVID-19. Because the virus knows no borders, the actions of one jurisdiction can easily impact a neighboring one. I can share with you that all premiers understand how important it is to consider the economic impacts related to our enforcement approach and the decisions around when we lift restrictions. In Yukon, my cabinet and I will evaluate all decisions on how and when restrictions are lifted by considering the advice of Dr. Hanley and that of our colleagues across the country. We cannot pretend we operate in a silo in Yukon, but we do know that our northern situation is different than our southern counterparts. As we determine what our territory's path for reopening looks like, we know that we are focused intently on how best to protect the health of Yukoners, how to protect our most vulnerable citizens, and how to support our economy. To best inform our decisions, we will continue to work with the Office of the Chief Medical Officer of Health, Yukon's business community, Yukon First Nations chiefs and community leaders, and our national counterparts. As plans are developed, we will keep Yukoners informed. Again, I appreciate that these are highly trying times. We want to return to life as it was, or begin again, but in a way that's even better. But it's not time yet. We must continue to be patient. We must remain diligent in the fight against this virus. I know some provinces have released early plans for reopening and lifting restrictions, plans being the big word there. It is important to keep in mind that in several provinces, safety measures were more restrictive, far more restrictive than they were in the Yukon or in what Yukon has placed so far. Their responses were, in many cases, much more severe. Because of this, they are now able to lift restrictions that we have not yet put in place and hope not to have to. For example, in Yukon, we have ordered bars and personal service establishments like hair salons and massage therapists to close. We have also prohibited dining in restaurants, though they still can provide takeout services as well as non-emergency dental care. Now, we recognize how challenging this is for business owners who have been mandated to close and feel paralyzed during this crisis. Please know that I want to close by thanking Yukoners for all of the sacrifices that they are making. I know that I'm not alone in hearing stories of great online gatherings or physical distancing, social interactions. I'm also so impressed with people's creativity and resilience, but I also recognize that this is not a replacement for the real thing. A hug from a friend, a shared birthday cake, a play date with little ones, friends and family. We all miss those moments. They're extremely important in our growth as people. But thank you. Thank you for keeping your distance, for washing your hands, for avoiding large gatherings, and for staying home when you're unwell. Thank you for adjusting your approach to work so that you can take care of your kids and still manage your projects. Thank you for rocking the floppy hairdos while you resist getting a home haircut. I appreciate all that you're doing, Yukoners. I really do. And I look forward to the day when we can continue and our normal lives or re-enter into what normal life should be. Thank you very much. And pass it off to you, Dr. Hanley.
Thank you, Premier. Good afternoon, and I hope everyone is doing well. And I want to echo the Premier's thanks to all of Yukoners for doing what you are doing to participate in the COVID response. Even though we only have had 11 confirmed cases to date in Yukon, it seems we've already been through several phases. It's all the more remarkable then that our official stage in the pandemic has not changed in 5 weeks. We have cases, but all cases are contained and all are related to importation from outside Yukon. We've been through the anxious time of preparation as we saw COVID's inevitable journey towards Canada. We watched through the first few cases in Canada, then the first signals of community spread in the provinces. We experienced together the first cases of COVID in Yukon, the first cluster and the second. Meanwhile, we crunched through the layers of advice and recommendations and the rapidly assembled orders to restrict borders and put in place all the necessary public health measures. We declared a public health emergency even before our first case, followed by invoking the Civil Emergency Measures Act. And now, like the rest of Canada, we are contemplating reopening and what that should look like in Yukon. So I want to start by reassuring you that we have been very actively working to support the government of Yukon in its planning to reopen. The decisions for reopening will be made by Yukon government and the Premier based on a public health framework and the advice coming from my office and the large team that supports my work. In turn, this public health framework is a product of intensive and frequent meetings with my counterparts and staff in all other jurisdictions, as well as the Chief Public Health Officer and the Public Health Agency of Canada. Our work right now is not so much about the details of a plan, but about what are the right principles to inform a plan so that it is safe, reliable, and has the trust of all Yukoners. We cannot wait too long, as we know there are significant, if not severe, financial, social, and health-related impacts to the current restrictions. But we certainly cannot go too fast and risk undoing the careful work that we have all participated in to date to minimize COVID's impact in Yukon. Let it be clear that if we relax too soon or too much, we could, in the blink of an eye, be overwhelmed by a local COVID outbreak or epidemic. At the same time, it's worth reminding ourselves of the following. We're still in a good place with high testing rates since we first had a test, and with confirmed cases limited to single cases or family clusters. We also, like the Premier said, have less restrictions in place than many other areas. So we can therefore concentrate on what we can do now while we work through the details of what reopening Yukon can look like. On March 22nd, I announced several public health measures to reduce the risk of transmission within our communities. This included closing the bars, transitioning restaurants to takeout or delivery only, closing personal services establishments, also prohibiting all but emergency dental services. In addition, I advised Yukoners to start practicing physical distancing, increased hand hygiene, staying home when sick, reducing non-essential travel to communities, and banning gatherings of more than 10 people. As a result of these measures, I know that some businesses, for a variety of reasons, decided to temporarily close or reduce operations. If your business is not required to be closed under the Civil Emergency Measures Act, in view of where we are today, you may, like the Premier says, wish to consider whether now is the time to reopen your business with appropriate risk mitigations in place. I know there have been some different interpretations about how the ban on mass gatherings applies to workplaces. Business premises or workplaces are not social gathering places. What is important for businesses to consider is how many customers and employees can be in an establishment at any one time while still supporting physical distancing of at least 2 meters apart. Other measures that should be in place include frequent hand hygiene for both employees and customers, ensuring people who are sick are staying away. My office is working on guidance to support businesses on how to safely provide services to their customers while protecting employees. General guidance for businesses is available on yukon.ca, and we're working to create some industry-specific guidelines to further support more specific needs. It's important to state that for many businesses, the public health risk is adequately minimized as long as physical distancing and hand hygiene practices are followed. For those businesses where there are increased risks identified through the public health orders, I commit to working with you to determine how you can safely provide services and allow Government of Yukon to transition towards lifting the current orders over time. I want to take a few minutes to discuss social connections, because I know many of us are struggling with the loss of the important connections in our life, with the families, friends, communities, and colleagues that we have. And while it's likely that physical distancing will continue to be part of this new Canadian normal, there are opportunities to connect and spend time with those who are important to us while still observing these public health measures. On April 2nd, the order released through the Civil Emergency Measures Act stated, not more than 10 persons may congregate in the same place, except when they are congregating in the place where they all reside. The legal interpretation of my previous order has caused some confusion, so I want to take this opportunity to provide clarity. The ban of gatherings again of more than 10 people refers to social gatherings. This means that any outdoor gatherings should be with 10 people or fewer, as long as individuals are appropriately spaced and follow appropriate hand hygiene. The current gatherings on people over 10 does not apply to retail or commercial or workplace operations. So how does that play out in practical life? In general, it means when inside, stick to your household bubble. People that gather indoors should be limited to usual household members and or close family members and should not exceed 10. In your workplace or for other organized gatherings such as worship services, observe vigilant physical spacing and limit the number of people, staff, customers, or clients in order to respect the physical spacing measures. It's important to remember that the maximum number of people per workspace depends on the size of the establishment and not the absolute number. However, people within a workspace must space appropriately and take all the precautions around hygiene. The reason for this is that people can transmit COVID-19 through respiratory droplets that can be passed from person to person or onto surfaces, often as a result of that happening through the close, prolonged personal contact that occurs within an indoor space. When outside, the risk of transmission appears to be much lower. In these settings, adequately spaced gatherings of 10 can be tolerated. An example I talked about recently was gathering around a bonfire. Many of us enjoy spending time around a campfire. So for outdoor gatherings of friends, it's a great way to get together while observing correct spacing. In the spirit of protecting each other and care, I want to point out today is the second day of National Immunization Awareness Week. The importance of this week cannot be overstated, as it's a reminder to us that vaccinations support our collective defense against disease. Routine immunizations are highly effective in controlling infectious diseases. However, delays or canceled routine immunizations due to events like COVID could potentially lead to outbreaks from vaccine-preventable diseases, and we have had those outbreaks before. To stay protected as a community, we need to take care as much as possible for all our health needs, including what we need to do to stay in good health. Make sure that your children or yourselves are up to date with immunizations. If you're not sure, talk with your health center, with the public health nurses at Whitehorse Health Center, or with your family doctor. As you know, we introduced new, broader testing criteria for the Yukon last Friday. We've always enjoyed a high testing capacity in Yukon, and we wish to maintain high testing rates. We've been planning this change for the last few weeks as we anticipated the end of influenza season and the need to stay in a good position as we plan together the framework for easing restrictions. One of the fundamental requirements is a high testing capacity. So, as reviewed last week, our new approach will now capture all individuals with symptoms of fever or cough or difficulty breathing, regardless of travel history outside of Yukon, and an expanded list of symptoms for individuals who have traveled out of territory. Testing persons without a history of travel is another way of ensuring that we're staying ahead of detecting community spread. The fundamental conditions of staying safe as we advance the conversation of opening up Yukon is the so-called Safe Six. The 6 steps to staying safe include the basic principles, as we've reiterated so many times. Physical distancing, staying at least 2 meters apart from each other. Regularly washing hands. Staying home when sick. Avoiding those gatherings of groups of 10 or more. Reducing travel to the communities, and self-isolating when required. These Safe 6 principles, when combined with the 6 Canadian principles for relaxing measures, are what will set us up for success in planning for the next steps. To reiterate the 6 Canadian principles, they are, number 1, that COVID-19 transmission is controlled to a level of sporadic cases and clusters of cases. In other words, the state that we're in now. Number 2, sufficient health system and public health capacities are in place. Number 3, outbreak risks in high vulnerability settings, such as continuing care, are minimized. Number 4, workplace preventive measures are established. Number 5, the risk of imported cases is managed through border measures. And number 6, that communities and stakeholders are fully engaged in the process. So these are the fundamentals. Over the next few weeks, both the Premier and I will be talking in more depth about how we can all align and plan a healthy and safe approach to opening up Yukon. Thank you.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll go to the phone lines now. Gabrielle, Whitehorse Star.
Hi. In regards to some businesses choosing to reopen, I'm hearing some confusion about gyms and fitness centers reopening. Can you clarify that fitness centers are not a personal service and why that is?
Yes, I can speak to that, Gabrielle. So, yes, like some other jurisdictions, and the approach has been different, again, in different jurisdictions, according to their interpretation, their public health acts, and their stages in the pandemic. But we have not closed fitness centers or gyms or ordered them closed. And some have chosen to close according to, again, according to individual criteria. That might be their capacity to maintain reasonable status while observing the physical spacing measures that would be required. So it does not fall under the Personal Care Services Act. These are fitness centers. Now, in the case of certain ones, like Better Bodies, which is probably the one that has had the most attention, they closed to readjust their measures and reopened, and we have been, through environmental health, we've been working closely with them to ensure that all the requirements are being followed as far as environmental health regulations, including cleaning and adequate spacing. So that again gets down to a matter of whether individual businesses feel that they can comply with requirements. If they have questions, they can bring them forward, and similarly, we can we can have them in touch with environmental health to ensure that if they have closed and choose to reopen, they can meet the necessary conditions.
Follow up, Gabrielle?
Thank you. Regarding your recommendation that people can still go outside and gather around a campfire, does that mean that you'll be making a recommendation that campgrounds open in the near future?
So that's a different issue about campgrounds, and it is one that I am working with the Yukon government to look at in more detail. Again, it comes back to what would be the requirements to enable safe reopening. So more on that to come.
And I'll add to that too that usually campgrounds open mid-May. So our government to date has delayed that opening by 2 weeks until the start of June. So campgrounds, again, are inherently a place where people gather, as you mentioned, Gabrielle. They bring people from different communities together in those shared places, including outhouses and cook shacks as common areas that are being used. And they don't have running water or systems in place for proper sanitation either. So we're currently working, through several different considerations for what campground operations are going to look like in the summer, taking into consideration the need for maintaining that physical distancing and proper cleaning and proper sanitation as well. So we'll share information as we get further into that into the summer.
We'll go next to Gord, Yukon News.
Yes. Have you seen an increase in testing yet, or do you predict to see an increase?
It's only been 3 days, so yes, we have had a spike in testing over the weekend. And that was based on the provider guidelines that were updated and distributed to the healthcare providers on Friday afternoon, evening. Yes, there has been a spike, but too hard to bring sort of whether this is a temporary spike, how this will play out. I do expect we will see increased testing. I think we have a little bit of a spike that I would suspect may not continue from day to day, but of course we'll bring you that data as we get a few more days under our belts to give a bit more of a proper analysis too.
Follow-up question, Gord?
I don't have any more questions. Thank you.
Thank you. Chris, CBC?
Oh, hi. It's a question for the Premier. Premier, your government obviously has had to issue a lot of orders in council during the course of this crisis. You've had to commit to spending over and above what was included in the budget as a result of this. I guess I'm just curious what steps your government is taking to ensure that with the Legislative Assembly not in session currently, that opposition MLAs are going to have an opportunity to scrutinize the various decisions your government has made over the past month or so.
Thanks for the question, Chris. No provincial legislatures are meeting right now. Our government is absolutely focused on how to manage through a national health crisis, unlike anything that we've ever seen before. And so we're focusing in on those daily tasks of working through crisis management. Our entire caucus is focused in on the needs of their constituents and of Yukoners, and I'm extremely proud of the work that they're doing as well. We did work with opposition parties to pass a budget in March and to adjourn the Legislative Assembly to allow us to focus on addressing COVID-19. Both opposition parties agreed to this, but we also committed to creating an opportunity for future scrutiny of the budget that we passed, and we are committing to that. But as that being said, right now our team is extremely focused on the immediate work that is needed, and I don't intend on changing that focus right now. But again, we did make a commitment to the opposition.
Follow-up question, Chris?
I mean, does that mean then that when the Public Accounts Committee convenes May 6th, that the Liberal members of that committee will vote in favor of the committee being able to scrutinize the budget?
So again, for you to ask me to comment or to hedge a bet on a committee that I don't sit on is I don't have an answer for you on that.
We'll move to the next caller, Claudiane, Radio-Canada.
Okay, hi. Yeah, I'll ask the question in English just because I'm not sure who will answer, but I could use an excerpt in French if possible. And bear with me, the question's a little complicated. So, the list of essential services or essential workers allowed in the territory is quite extensive. It does appear some loopholes are in there, such as workers for welfare of animals, including boarding, kennels, stables, etc., but not handlers for a tourism expedition company. Is that list going to be revised given your preparation to reopen economy, or what should an entrepreneur do to get those details revised for them to have the workers that they are currently trying to seek into the territory?
So I can start, and if you want to add in too, Doctor. So thank you for the question, Claudiane, and if the answer is going to be in French, it's probably going to be Dr. Hanley, and I apologize for that. What we, the essential list, again, this was a coordinated effort, federal government, working with provinces and territories as well to establish that list. And again, in that list, identifying certain workers who can continue to work because they are essential service. But as Brendan and I both spoke about today, if you're not on that list, and if you aren't providing a critical or essential service, then you do have the option of being open or continuing your work as long as you are adhering to the mandatory requirements. The good news about living in a small jurisdiction like Yukon, we have the ability to look at more of a case-by-case basis than you would, let's say, if you were in La Belle-Provence or some other province as well. So again, it's one of those things where we want to make sure that everybody who's paying attention to this question, who's interested in the answer to this question, reads the guidelines first and foremost to see if you qualify as an essential or a critical service. But if you don't, there are provisions to allow you and your industry to still maintain services in Yukon, even if they're not listed as being essential.
Going to do it in French?
Yeah, I think maybe a translation of that might be better later, just to be more accurate, especially because it's not directly in my purview.
Okay. Claudiane, we'll follow up with that answer in French following this, if that's okay.
That would be great. Just
Okay.
for precision, those are workers that are now currently stuck in Fort Nelson trying to come into the territory for work. Follow-up question.
Go ahead,
The
please.
plan that you have been, en français, en fait, Dr. Hanley, vous avez mentionné qu'il y a un plan de réouverture ou d'assouplissement à venir dans les 2 prochaines semaines. Vous avez mentionné ça la semaine prochaine. Est-ce qu'on envisage toujours le même délai de temps pour assouplir éventuellement quelques mesures? Est-ce que ça s'en vient bientôt?
Donc, la question c'est, je crois la question c'est si toujours un plan serait prêt pour mettre en place dans les prochaines 2 semaines. Et donc, je peux dire qu'on va parler plus et plus avec chaque événement pour les médias de qu'est-ce qu'il faut pour un plan. Donc, le plan, c'est le travail du gouvernement du Yukon et le conseil, les recommandations pour le cadre, l'encadrement du plan, c'est le travail de moi. Donc, c'est vraiment un travail ensemble. On attend d'avoir plus de détails toujours dans les prochaines 2 semaines. On peut pas dire, je peux pas dire la date finale pour ce plan. Donc, on va vous mettre, on va faire les, on va annoncer quand on est prêt à annoncer une date précise. Mais on va mettre on va expliquer tous les besoins en plus de détails pour avoir un plan. Mais c'est important aussi pour dire que le plan, c'est quand c'est prêt et quand c'est préparé et annoncé par le gouvernement, le plan, c'est pas le même que le commencement de plan. Donc, le plan va parler de les dates pour mettre en place les mesures sur le plan. Si je peux, j'espère que c'est assez clair. Donc, je vais peut-être expliquer en anglais. The question was about the date for a plan, and I said that the plan is the work of the government and up to cabinet and Yukon government, and my job is to help provide the framework and the public health framework and the advice to inform that plan. And as we get closer, we will, with each media update, explain more about what is required in the plan. And when we have a date that we can be confident about announcing the plan, the Premier I'm sure will be happy to talk about that.
Yeah. And Claudiane, in response to your original question as well, if you're talking specifically about people that have been denied entrance into the Yukon, the Civil Emergency Measures Act has baked right into it the ability for appeal on a case-by-case basis that would go through the Minister's office as well.
Thank you. We'll go to the next caller. Julien, Aurore Boréal. Julien? We'll move to Jane from CBC.
Hi, this is a question, I'm not sure for the Premier or for Dr. Hanley, but as part of that, the Safe Six that Dr. Hanley spoke about is the imported, stopping imported cases and having these border measures where we've seen 15 people turned away. There's been concerns, I guess, if are those people being turned away Americans or Canadians? I'm not, and it sounds like it's not being tracked if they're Americans or Canadians. I guess, can you reassure people, or do you have any insight on who has been turned away at the BC-Yukon border?
Thanks for the question. I'll start by saying, starting with a shout out to the employees, the government employees that are at the borders, that are dealing with the enforcement provisions under the Civil Emergency Measures Act, and also the coordinated effort that our government and our officials are doing, working with First Nations governments, municipalities, on relaying information and making sure that that people are showing up where they should show up. When it comes to travelers traveling through that are American, again, if it's where's their destination? We have a lot of people that do work with inside the Yukon that are of American background, and if they are providing an essential service, or if they have a family member or whatever, there's reasons why they go into self-isolation and then from there into the community in which they're supposed to be going to. But there's also the provision for people moving through to Alaska and getting there as quickly as possible within the 24 hours that is required. And we are, continuing to work on making sure that we coordinate with communities on those safe passages. But right now, again, if you're on your way to Alaska, our goal is to make sure that we don't impede your travel and that your travel does not affect our medical system. Please.
If I could add one thing, it's not so much on that specifically, but Jane, there are two sets of six, and so the Safe Six, what I refer to as the Safe Six, are what Yukoners can do to stay safe and throughout the next however long this period will be, the 12 to 18 month period I talked about earlier. And that's about the physical distancing, hand washing, staying home when sick, not gathering in groups more than 10, reducing travel to communities, and self-isolating when required. So the other six are the requirements that we need to have in place in order to have an opening up process. And one of those requirements is border restrictions or control of border access.
Follow up, Jane?
And this is a question I believe has been asked before, but how is it enforced with people traveling to Alaska if they're at 20 hours and they haven't crossed the border? Is there a search that goes out for them, or how is that 24 hours enforced of having to pass through here to get to Alaska?
Yeah, right now, again, this is it's a moving target. We're working with other governments and communities, and right now we do have community liaison officers that work directly with different communities, both on the municipal level and also the First Nations levels, whether it's through Aboriginal relations in my department or through community services. And we are relying on input in a lot of cases from community, and we're getting a lot of calls or actually emails into the email address. There will be a phone number available as well, which will help a lot, and that's coming very soon in helping in those provisions. And again, we will continue to work with communities, especially communities that are along those transportation highway networks, to make sure that people are in compliance. And this is where, when we speak about life after COVID and how it might not be a normal, but it'll be a new normal. And one of the things that I'm most proud of is our ability now to use the new conduits of communication that we've established in this crisis to be better as governments communicating with each other once we get past COVID and into just the regular daily business. So again, the phone number, which will be coming soon, will be quite helpful in this pursuit of this particular question that you're asking. And right now we are relying a lot on other communities and other governments, and also our officials that are working in those communities as well, whether that be in lands departments or other agencies as well.
Thank you. We'll go now to Tim from CKRW.
Hi, good afternoon. Just expanding on Claudiane's question a little bit in regards to reopening, which seems to be the theme today. I know you'd exercise an abundance of caution, but just in the planning, using the spectrum of beginning, middle, and end, I know you'd already said a few weeks, but using that spectrum, kind of where are we at?
So, Tim, I think that you're referring to where are we at in the planning process. Is that correct?
Yeah, that's correct.
Well, let's say we've been anticipating this for a few weeks, and the process really right now, the most intensive process, as I referred to during my little talk, was that we're working very closely right now with with our counterparts across the country and with the Public Health Agency of Canada. So it's really setting in place the principles. So even I know there is a lot of moving parts. For instance, as the Premier said, some provinces have already put out their plans early, even if they vary in the amount of detail that they might have. But at the same time, we're kind of sticking to a federally organized, coherent process of working out the principles of what does it take, including those 6 measures that I take, and then and fleshing that out in quite a bit of detail. That in turn would help to inform an approach to assessing priorities for reopening. So I would say that even though we're talking about a relatively brief time period, we're talking weeks here, not months. We're still early in the plan because we're still solidifying the principles. But as I say, we're working closly with Yukon government at the same time as they put a lot of thinking into all of the facets of reopening, and especially in terms of the economic aspects. But I might let the Premier speak to that more to that.
Yeah, I have a unique position being the only Premier who's also the Minister of Finance, and so we have national calls from the Council of the Federation, which is all of the Premiers, and then the First Ministers meetings, which is the Premiers and the Prime Minister, but then Finance Ministers meetings as well. And you can imagine in each one of these weekly updates and weekly conversation sessions, we are all talking about how to coordinate efforts in regions that it's hard to coordinate because we're in different stages, we're in different geographical areas, we have different populations, those types of things. But mainly right now, the conversation should be focused in on those principles that Dr. Hanley spoke of. The federal government wants to work with the medical communities, wants to work with provinces and territories to define those principles that form a backbone of you need to haves, must haves, cannot haves before regions start talking about a plan to reopen economies. And it's an extremely important process. And we do know that every jurisdiction is getting a lot of pressure to reopen. We're also getting a lot of pressure from folks who have done extreme measures and have affected their own lives, their own families, their own livelihoods to get us to where we are, to have that curve reduced, and hoping that any more actions coming from the governments don't make all of those efforts be in vain. So it is a balancing act, and the coordination is extremely important. The federal communication is extremely important as well, and that's where we are now. And we heard the Prime Minister today speak of this week having some more information to share on the good conversations, the planning from the provinces and territories and the federal government. When it comes to principles, we will move forward in a calculated manner based upon evidence and based upon the extremely important information that we're getting from businesses, from the medical community, from the public health agencies, from the businesses in each region as we plan as a nation to move into the summer months from the spring months.
Follow-up question, Tim?
Granted that there's no community transmission here, we're one of only, 4 jurisdictions in Canada. Is there any thought or consideration of maybe going ahead of those national parameters that you said you're working with, the federal governments and other jurisdictions? Is there any consideration of going ahead of those parameters given no community transmission?
Those parameters are extremely important for if and when we get to a place where we can start opening our doors. If a provision happens where a community spread starts, you have to have the personal protection equipment in place. You have to have the ability to spring back into those, into the normals that we're used to now. So it's not about the fact that we don't have community spread now. It's more about as we move forward, it would be we can't put ourselves in a situation where we're not prepared if some of these actions create community spread. And I think that that's the biggest concern that definitely keeps myself and Dr. Hanley up, is we've done so much good work. The reason why we don't have community spread right now is because of all the work that Yukoners have done. That's the number one reason why we are here where we are. That doesn't mean that we're protected from community spread later. So these guidelines, these principles are making sure that as governments prepare, we want to make sure that the public health advice is being adhered to, and that the public institutions of health are prepared for community spread as we change from complete protection on one side of a curve to relaxing on another side of the curve.
I might add a couple of things. One is, if we detected community spread tomorrow or next week or next month, we would put in place the measures that we need to, and of course that would mean holding off on some of these measures, opening up measures that we're contemplating right now, and I'm confident that we would do it. But our aim is to prevent community spread, to continue to prevent community spread. That's our goal. The other thing I wanted to say is that even without community spread, we could have a large cluster event, a large outbreak, community-based outbreak. Any of these things are still, even without community spread, are threats that could, at least temporarily, potentially overwhelm our capacity in healthcare to deal with it, or certainly stretch our capacity. So these are also things that we are trying to prevent, again, with all of those basic measures in place.
Thank you. Have we missed anyone on the line? Hearing no, I think we'll end for today. Thank you very much, Premier Silver. Thank you, Dr. Hanley. The next CMOH update will be Friday, May 1st at 2 p.m.
Thanks, Pat.